Hello everyone and welcome back. Today we will discuss about a case where the antibody screen was positive and how we narrowed down our conclusions to two specific alloantibodies which were identified in these patients. We have already shown you the process of performing antibody screening, antibody identification, and how do we cross out our antigens and confirm them. So various such scenarios with different combinations do present to us in our day-to-day practice. But with following meticulously the basics will help us and guide us in resolving them successfully. So many a times we need to take help of other advanced investigations like the use of enzyme panels, performing adsorption and elution techniques. But these techniques we will be discussing in the successful videos later on. So now let's hear to Dr. Prachi about the present case where we identify two alloantibodies.
This is a case history of a 36-year-old male patient whose sample came for group and screen. His group was O positive and screen came out to be positive. He had history of road traffic accident 5 months ago. He was transfused 2 units PRC at that time. During current workup, his autocontrol came negative and that was negative. We proceeded with further antibody identification. We use Biorad's ID Diacell commercially prepared red cell reagent 3-cell panel. On column agglutination technology AHG gel card, in the first cell there was no reaction. In the second and third cell there was strong 4 plus agglutination reaction. This is Biorad's corresponding antigram for the 3-cell red cell reagent panel which we use. We mark the corresponding reactions of the cell on the antigram. In the first cell, 0 reaction. In the second and third cell, 4 plus reaction. Now, we can cross out the antigens on the antigram. If a cell shows 0 reaction, then that corresponding antibody can be ruled out from the patient's plasma by crossing it out on the antigram. After crossing out antigens on the antigram, the probable antibodies in the patient serum are anti-kit B antibody, anti-Duffy B antibody, anti-small c, and anti-capital E. Once the screen comes positive, we proceed with antibody identification using Biorad 11-cell panel. The reactions obtained on the AHG gel card are: in the first cell 3 plus reaction, in the second cell 3 plus reaction, in the third cell 4 plus reaction, in the fourth cell 3 plus reaction, in the fifth cell 4 plus reaction. On the sixth cell we got 0 reaction. On the seventh cell there was 3 plus reaction. In the eighth cell no reaction. In the ninth cell 3 plus reaction. On the 10th cell no reaction, and in the 11th cell 3 plus reaction. This is the corresponding antigram of the 11-cell panel which we use. We mark the reactions on the antigram as obtained on the AHG gel card and begin crossing out the antigens on the antigram. After crossing out the antigens on the antigram, the probable antibodies in the patient serum are anti-kit B antibody, anti-Duffy B antibody, and anti-capital E antibody. Since the last PRC transfusion was more than 3 months ago, we can proceed with antigen typing of the patient using commercially available antisera. The patient was negative for capital E antigen, negative for KIT B antigen, and positive for Duffy B antigen. Hence, we can conclude that the patient has anti-capital E antibody and anti-KIT B antibody in his plasma.